Maxwell.
Good morning, Chairman Murphy, Ranking Member DeGette, and other distinguished members of the subcommittee. I'm pleased to join you today to discuss how we can protect Medicare's prescription drug program from fraud and abuse. The OIG has made a strong commitment to help safeguard Medicare Part D. Just last month, OIG special agents and other law enforcement personnel fanned out across the country to conduct the largest criminal healthcare fraud takedown ever. A number of the arrests were for doctors and pharmacy owners involved in prescription drug fraud. And there are likely to be more arrests because we have found that Part D continues to be vulnerable to fraud. Recently, we identified 1,400 retail pharmacies with questionable Medicaid payments. In one example, a Detroit area pharmacy billed for commonly abused pain medications, opioids to be exact, for 93% of its Part D patients. As this committee is well aware, abusing opioids can lead to patient harm and even death. It is also tied to illegal drug trafficking, which is why the OIG is not stopping with the recent takedown. As our special agents investigated and built these cases, OIG analysts were already proactively mining the data to identify new leads to help us, CMS, target and shut down this problem. As important as our law enforcement efforts have been, we cannot arrest our way out of this problem. We have to strengthen our defenses. OIG has several outstanding recommendations for fixing some of the systemic vulnerabilities that allow fraud and abuse to slip through undetected. To start, CMS can better leverage data as a tool to improve oversight and to keep up with the ever-evolving fraud landscape. This should include collecting the data necessary to ensure that plan sponsors, the hundreds of private companies that administer the program, are effectively protecting the program. These plan sponsors are Part D's first line of defense. Currently, as we've already heard, CMS does not require these plan sponsors to report on the fraud and abuse that they identify. While plan sponsors may report this information voluntarily, given the choice, we found that less than half chose to report. Information on identified fraud and abuse, as well as how sponsors handled these cases, would help CMS assess the effectiveness of sponsors' efforts to protect Part D. Better leveraging data should also involve expanding the analysis of the data CMS already collects. We recommend that CMS and plan sponsors monitor payment data for a wider range of drugs prone to abuse. CMS does have several key initiatives underway focused on opioids. And while opioid abuse is certainly a major concern, OIG has identified questionable billing patterns related to other drugs. This includes non-controlled substances, which can present a substantial financial loss to Medicare and can be abused in combination with controlled substances. In addition to better leveraging data, plan sponsors and CMS should buttress current defenses by adding the following 3 oversight tools to their current efforts. First, plan sponsors and CMS need to implement stronger payment controls to stop paying for things they shouldn't be paying for, like payments for drugs prescribed by doctors excluded from the Medicare program, or paying for illegal refills of controlled substances. Second, another powerful preventative measure would be a lock-in program that restricts certain beneficiaries to a limited number of pharmacies and prescribers. This tool allows for better monitoring to prevent at-risk beneficiaries from overutilizing drugs that might harm them or diverting those drugs for illegitimate use. Finally, we recommend that CMS improve processes to recover inappropriate Part D payments. Our recent law enforcement and data mining efforts show that the current defenses are not strong enough. Plan sponsors need to reinforce that first line of defense, but they cannot be the only line of defense. Ultimately, it is CMS that is responsible for ensuring the integrity of Part D. For our part, we'll continue to focus our full array of resources on protecting the program, and we stand ready to work with you, with CMS, and others to improve program integrity. At this time, I'm happy to be of assistance and answer any of your questions. Thank you so much.